today I'm going to be doing a sinus series and mandible. Before I go get my patient, I'm going to make sure my room is set up. My tube is detented. I'm set at 40 inches from the wall lefty. And I'm going to use an 8x10. I'm going to be using 8x10 films for all of these images. So I got my film in the bucket already, and my technique is going to be anywhere from 60 to 80 kV with, we'll probably use 6 to 12 max. So now I'm just going to go get my patient. So now I'm going to go grab my patient. Hi, when is your birthday?
9/17/90.
And your last name?
Kleinhammer?
Any chance you could be pregnant?
No.
Okay, well my name's Brianne. I'm going to be taking some x-rays of your skull today.
Okay.
I'm just going to have you come and stand right over here up against this board for me. And why are we doing these x-rays today?
I'm having some sinus pain, and also I'm having some pain in my chin here.
Okay, so I'm going to make sure my patient's shielded, and we're going to start x-rays. So I have my patient in lead, and I'd have her remove any jewelry, any earrings, hairpins, that kind of thing. So she looks all set, even though she's got her earrings in. My marker is on the board. So our first shot that we're going to start out with, I have a 15-degree cotted angle on the tube. We're going to be starting out with a Caldwell projection. So we're going to have the patient put their forehead and nose on the board, touching the board. You can do this erect or prone. The mid-sagittal plane is going to be centered to the IR, and her OML right here is going to be perpendicular to the IR. I already said the 15-degree caudal angulation for this, and we're going to have a horizontal beam that's going to exit the nasion right there. So our next position that we're going to do is the parietocanthal waters. So in this position, she's going to have her head tilted up and her chin on the board. So the MSP, or the mid-sagittal plane, is centered to the IR. The OML is 37 degrees to the IR. So this angle is a 37-degree angle to the center of the IR. And we have a horizontal ray that exits the acanthion right there. So we have no angle on our tube, it's just straight. So now we're going to do our lateral projection. The head's going to be in a true lateral. We're in a left lateral. The MSP, mid-sagittal plane, is parallel to the IR, and the interpupillary line is perpendicular to the IR, right here. And we also have a horizontal ray that's going to enter half an inch to 1 inch posterior to the outer canthus, so it's going to be somewhere around here. Got my marker on. Is the SMV, submental vertical. For this one, it's a little tricky for the patient. Best to have him in a chair with a back. This one's on a stool. But we have the patient seated, and you have them slowly kind of bend back so that the vertex of the skull is touching the IR, just like so. The IOML is going to be parallel to the IR, and the tube is going to be perpendicular, no angle, straight on. And the CR, the central ray, is going to enter 3/4 anteriorly to the level of the EAM. Moving on to the mandible, we're going to be doing a PA mandibular body. The mid-sagittal plane is going to be perpendicular to the IR, and the nose and the chin are going to go on the IR. The acanthomeatal line is going to be perpendicular to the IR. This right here. This right here, perpendicular. And we're going to have a horizontal ray that's going to exit the lip. So now we're going to do the axiolateral oblique mandibular ramus image. The mid-sagittal plane is going to be parallel to the IR, and we're going to have the interpupillary line perpendicular to the IR right here. And the AML, the acanthomeatal line, is also going to be perpendicular to the front edge of the cassette. Our central ray is going to have a 15 to 25 degree cephalad angulation, and it's going to be centered on the area of interest wherever she's having the mandibular pain. If we're x-raying the mandibular body, we're going to rotate the mid-sagittal plane 30 degrees to the IR. So she's kind of going to have her face angled inwards a little bit. And if we're looking at the mandibular symphysis, we're going to rotate the mid-sagittal plane 45 degrees to the IR, so a little steeper. This is our PA projection of the mandibular rami. We're going to have the mid-sagittal plane perpendicular to the IR, and the forehead and nose are going to be on the IR, similar to the Caldwell. The OML is going to be perpendicular to the board here, there. Oops. And we're going to have a horizontal ray that's going to exit the acanthion right there. So this is our SMV projection of the mandible. For this, once again, we're going to have the patient seated, preferably with a chair with a back on it. You're going to have the patient lean back. So the vertex of the skull is on the IR. We're going to have the IOML perpendicular with the IR. The central ray is going to be perpendicular to the IOML. I'm sorry, the IOML is parallel to the IR for this. The central ray is perpendicular to the IOML. And it's going to be centered between the angles of the mandible, so right in here. So now we're going to look at some images of the sinuses. This first one is our parotacanthial waters view, and this view shows the maxillary sinuses right here, as well as the frontal. So for the maxillary, and you can collimate just down to kind of the size of the sinuses that you're looking at. This is our PA axial Caldwell image, and this shows the frontal and the ethmoidal sinuses. This is the lateral view. This shows all 4 sinuses. The bones are kind of supposed to be superimposed on each other, the mandible as well as the sella turcica, and that's how you know that the patient is in a true lateral. So this is the PA mandibular rami. The requirements for that are that the mandibular bodies in the rami should be symmetrical on each side, and that the entire mandible is included. And also the condylar processes should be demonstrated when you have a central ray that is angled cephalic. This is the PA mandibular body X-ray. The criteria for this is that the mandibular body and the rami should be symmetrical on each side, and the whole mandible needs to be included. This is the axiolateral obliques of the mandible. The side down right here is the side that's going to be viewed, and the opposite side of the mandible, this upper part, should not be overlapping the mandibular body, so this can be clearly demonstrated. So this is the SMV projection of the mandible. The condyles need to be demonstrated, and the mandible should not appear to be foreshortened. This is the submento vertical image for the sinuses. For this view is going to demonstrate the sphenoidal sinuses as well as the ethmoidal air cells. The distance from the lateral border of the skull to the mandibular condyle should be equal on both sides, and the mandibular symphysis should be superimposed anteriorly to the frontal bone. And that's all for our sinus and mandible series.